Good afternoon, everybody. I'm Clifford Shannon, Deputy Director of the 9/11 Memorial Museum here in New York. As you know, the museum has been closed since the middle of March, and we wanted to maintain our public program planning and put them on a digital platform because so much of what we talk about in relation to 9/11 connects us with what we're going through now. And these are conversations that we hope will allow us to explore the world we live in now and the world that was shaped by 9/11. Today is May 29th, and tomorrow, May 30th, is the 18th annual commemoration of what we know of as the cleanup period at Ground Zero. This was May 30th, 2002, when after nearly 9 months of work by thousands and thousands of people who came to the site to serve, both initially to rescue, but then to recover the victims of 9/11, and then to remove all of the building elements and everything that was there so the site could somehow be restored. 18 years have passed since that time. And it's a day when celebration to some degree should be appropriate because of the extraordinary work that went on there 24 hours a day, 7 days a week. But that is tempered by the realities that revealed themselves very, very quickly as the work at Ground Zero unfolded. The illnesses that people began to feel and that have continued to plague them, costing many lives and much illness in the years since. So the celebration of this extraordinary effort is marked by the commemoration of those who were lost and our concern for those who still suffer from the service and sacrifice that they offered on that day. Tomorrow, Saturday, May 30th at 11 a.m., if you come back to this link, you will see a 1-hour program that we've put together to mark this annual commemoration. Unfortunately, we cannot, as we have done in the past, offer this commemoration on the plaza itself among ourselves. To talk about this, I am thrilled to welcome my guest today, Dr. Kerry Kelly. Dr. Kelly is the daughter and granddaughter of members of the Fire Department of New York, the FDNY. She graduated from Vassar College and Brown University Medical School after a couple of years in private practice. In 1981, she joined the fire department as the first woman to serve as a physician in the FDNY. And 13 years later, in 1994, she was promoted to the FDNY's chief medical officer. Again, the first woman to hold that position. In her role there, Dr. Kelly introduced the FDNY program of annual medicals, a yearly medical exam that became even more important, and this really turned out to be key after 9/11 because it meant that the department had an extensive health baseline data for all of its members, including those who had suffered from their work at Ground Zero. The database allowed Dr. Kelly and her colleagues to illustrate that 9/11 debris and dust, as it had been taken in by the first responders, had a measurable and demonstrable impact on their health. Dr. Kelly testified before Congress following the attacks, and her testimony helped secure federal funding and as well invaluable awareness of the mental health burdens on those who had served over those long, long months. Together with her colleague at the FDNY, who we have spoken to in a previous program, Dr. David Prezant, Dr. Kelly initiated the monitoring and treatment for firefighters after 9/11, and though she retired as the department's chief medical officer in 2018, she continues to be involved with the World Trade Center Health Program in the treatment of first responders, some of whom have, of course, greatly increased vulnerability to COVID-19 as a result of their 9/11 related illnesses. She is still in private practice on Staten Island and is herself a 9/11 survivor, having responded to the towers on that day. Dr. Kelly, it's a thrill and an honor to welcome you here. I know you came and spoke at our annual dinner 2 years ago, so this is your continued offering to us, and I'm very grateful for it. Let me just remind our visitors before I ask the first question of Dr. Kelly. This program is being live captioned, and so if you want to access those captions, click on the link below the video window. And if you want to ask Dr. Kelly a question during the course of the conversation, please do. You can click the chat bubble on the right side of the screen, and I will get that question. But I get the first question, Dr. Kelly, and I want to ask you whether, as you look back now, those 18 years since May 30th, 2002, but then, of course, extending back to 9/11/2001, are you surprised today by what has emerged as the medical emergency over the long term that has affected the first responders and the rescue and recovery workers?
Am I surprised by what we're seeing from a medical viewpoint with our members? No, I'm not. Having been there that day, there was really an incredible toxic mix when those buildings came down of very irritating alkaline materials, as well as jet fuel, PCBs, dioxins, asbestos, any number of materials there that were being breathed in by those who were there at that time, so that the exposures were clearly very great. You mentioned in our monitoring program, we have been able to gather data, and that data has really shown that the exposures played a big role in the outcomes from a physical health perspective. So that if you were there in the morning of at the time of the collapses, you had the greatest rate of problems. Also, the people who arrived that afternoon somewhat decreased the next week and then falling off after that. We also showed exposure based on the amount of time there. Many of our members spent months at a time working at the site. For so many of our members, it was really a labor of love to be there and looking for the people who were missing. We had brothers, we had fathers, we had people there looking for co-workers as well as the civilians, and they really took that to heart. When you think now of the current crisis, we talk a lot about PPE and the value of PPE protecting our first line of defense. When people were there that day, firefighters have an SCB mask that they put on. That lasts about 15 minutes. So that was not adequate protection, certainly in the first few days that people were there. With time, we were able to improve that by having people fitted for a P100 mask, which gave better protection. But there were clearly many days where people were not well protected. So the exposures that were there that day, both physically and mentally, have played a big role in the illness that we saw soon after 9/11 and have continued to see years later. Initially, when we did our medicals, we began a program in October of 2001. And over the next several months, we did 10,000 medicals. And as you pointed out, our pre-existing information allowed us to see real comparisons. You have to understand, we had a very well workforce, people who were in good health and taking care of themselves. So this was a dramatic change for many of them, the introduction of these medical problems that they had not had before. So the types of problems we saw included upper and lower respiratory problems, as well as GERD. Again, we believe due to the difficult toxic exposure, as well as the stresses of being at that site. So that we were able to show those statistics, and that helped us show the scientific world and certainly help the legislation who we needed to give us long-term medical relief. And that funding was essential, and we were able to, I think, help people understand how important that was because we had the scientific data.
Let me ask Dr. Kelly, got a question here from Pamela, which is connected but not directly the same as your comments about the first responders, who obviously you were monitoring very closely. downtown residents, people who were in that area, what can you say about their exposures as well? This is obviously something that in the environment was affecting everyone. And as you will recall from those times, the initial assurances by the EPA and others were that the air was fine to breathe. So were you aware of the disparity between what was being said about the quality of the air and what your perception was? And what was your concern for not just people working on the pile, but those in the vicinity?
Yeah, the concern for all people exposed is certainly significant. My work was pretty much focused on the fire department, as that's who I was involved with. But clearly, there was a need for people to see what was happening to the civilians and the survivors on the ground, the people who live there, the people that work there. And different programs have taken care of those groups of people. Currently, there's a consortium of different medical groups that get together under the World Trade Center. So we have Mount Sinai, we have NYU, Bellevue, Rutgers University, Stony Brook, as well as the fire department, who really look at different groups of people to see what's going on. The New York State or New York City Health Registry also is a program that has allowed people to look into their long-term health consequences by a reporting system that allows them to give feedback as to what's going on. There's clearly the need to continue to monitor people in the long term because the exposures that people had were not just concerns for the short term, but for the long term. Many of those substances have a real concern for long-term development of cancers. We initially thought that might not happen for many years, but we started seeing it soon after 9/11. The advantage of our program really has been we have a pre-existing set of information in a healthy work population and pre-existing health records. When it comes to the general population, all that information is not so readily available. But there are clearly programs in place to help that group of people as they have dealt with different health issues.
Let me take you back to an interview you gave after 9/11, shortly thereafter, and you were commenting, as you know, the hospitals were getting ready for this influx, massive influx of injured and so on. And you said there were very few patients, and that unfortunately reflected the reality of that day and of that time. But the irony, which is not the right word, but I'll use it. The irony is that the number of patients that you and the fire department, and then from the rescue and recovery community, downtown residents, has grown geometrically over the years. So starting with almost zero patient base after 9/11, but a very small one, not quite zero, it has really expanded very, very dramatically. And I wonder what has been the impact on the first responder community as you've monitored the increase in illness on the mental health, the emotional impacts of these things. The event is not over. The event seems to continue indefinitely through people's lives. Was everyone down there affected? Were there those who escaped the physical impact of this over time? Or is this something where it is the mark of anyone who was working down at the pop?
I think the awareness that people have that they have an increased risk of problems is important because it helps people understand that they need to take care of their health, that they need to make sure they do the basics that one would expect. For instance, we want to make sure people get colonoscopies when they should. They should get periodic blood work. They should be making sure that they don't smoke. They should take care of their general health with good nutrition and exercise. I think the value of any monitoring program is to stress checking into preventive issues so that you can help people not have a problem, or you can at least catch a problem earlier. I think that's been a big advantage of our monitoring program, is we paid attention to those aspects. We have often, through our routine blood work, picked up people who had problems with leukemias or other medical problems. We've picked up people who had lung cancers or other pulmonary problems on their breathing tests or on their chest x-rays. So I think anybody who is at that site, anybody who had an exposure, needs to be aware that they may be at increased risk, take care of their health, and get attention. And there are programs in place for people for that very reason.
Let me ask one of your colleagues, retired Chief Joe Krebs, wants to pick up a little bit further on your immediate reaction when Chrissy Todd Whitman, who was the EPA director at that point, made this statement that the air downtown was safe to breathe. Was this something that struck you as off from the very beginning, or was this something that you came to realize over a period of time?
Anyone standing at that site knew that that remark made no sense. For the first several days, you had trouble seeing because the air was still so thick and there was so much in the air and all around you. It was really a toxic site. So it was very hard to accept that the air was acceptable. One of the problems is, how do you measure some of these different components? You had quite a bit of different materials at different sites. So you're not always able to say, this site here has the exact same exposure at another site. But the entire area was really just filled with debris. And if you remember, months later, we've still found materials up on the tops of buildings and in different areas that people had been unaware of. So that cleanup really was a long-term coming, and it took quite a while. So I don't think anyone really believed the air was clean and that we were not to worry. I think our program was based on the premise that we needed to be on the safe side and we needed to acknowledge the exposures our members had.
Let me ask Dr. Kelly, your own story brings you to the World Trade Center on 9/11. You were, I believe, seeing patients on Staten Island at that point. And if you would take us through that day, you were there in time for the collapse of both towers. And I want to know what your expectation was, what you thought you were going to, and what you found when you got there. How different was what you found from what you expected it to be?
So I was making rounds at the hospital with patients, and on my beeper, I was given a notification that a plane had landed or hit the World Trade Center. And someone had a television on and I could see flames. And I said, I should go to this because my job as a chief medical officer was to respond to multiple alarm fires, particularly if there was concern for the safety of our members. So I got in my car and I drove into the city. And as I came out of the tunnel, the streets were filled with debris. So I parked my car, and as a true New Yorker, I said, I have a parking space. And then got out of the car and put on my bunker gear, and several firefighters said, you need a helmet, Doc. And we went over to a firehouse, 10 and 10, to get a helmet. And as we walked over there, again, the streets were filled with pieces of plane and other just terrible sights, and people were coming out of buildings, and it was just an incredible situation. And as I went into 10 and 10 to get a helmet, on the television, it showed the bombing of, the attack on the Pentagon. So it was clear this was an attack on our country in multiple sites. So as I came out to look for the command center, already one of our members had been hit by the debris and sustained what would be a life-threatening injury to that person. We got him on an ambulance and had him sent to the hospital. As I crossed the street, someone said, the tower is falling. And I turned to see the South Tower was falling. So I huddled against the side of one of the buildings there. And as the debris rained down, I just waited to see what would happen. And at the conclusion, I was happy to be alive. And then walked out into what was now an eerily dark black site with falling pieces of paper and just a moonscape all around. We started finding people that we could help. So we took them into an area where they would be protected because there was, parking garages there. And then we were able to get an ambulance to bring people over toward the water. In between, someone said the North Tower is coming down, and someone grabbed me and brought me into a rotating door, and the debris flew by, and I survived the second tower. And then we went and helped the persons to get over to the East River so that we could, over to the Hudson rather, so we could get them on barges to bring them to hospitals. And I remember looking out and seeing the Statue of Liberty still in the sun, as though it were a completely different day and a different weather pattern, and thinking, what will be next? And also thinking, the world my children will live in will never be the same. The feeling of security and confidence that we live in a safe place is really shattered. And I think that was one of my first thoughts that day. I went down toward the battery, found Dr. Prezant and actually Chief Nigro, now Commissioner Nigro, and we walked back up and started to set up a immediate care center in Lower Manhattan, right by the City Hall. And again, the sad news is not many people came because so many people were gone. But seeing the response of our members was incredible. There was an all-out call for people to come off duty, and they did. Retirees, actives, the streets were filled with people responding, some with their bunker gear, some without, but everyone came forward. So that by that afternoon, there were an incredible number of people there ready to help, ready to look for people who were missing and to try to do what they could for the people who were there. So it was an incredible response from the fire department, and I know other first responders too, but to see so many people come forward and help and assist was truly awe-inspiring. So at the end of that day, we went back to headquarters where we had our health services, and we really started talking about how are we going to respond to both the physical as well as the mental health issues, because clearly so many people have been exposed not only to the physical problems of that day, but also to the mental health issues that revolved around the loss of so many people.
I wonder of your own experience, and I read an interview you did for the fire department just a couple months after. You are torn, it seems to me, between this extraordinary personal danger and the emotional impact of what you are seeing and what you're going through. At the same time, you are the chief medical officer of the department. You know your services are needed. And I wonder if you could talk about, I don't want to call it a tension, but how those two things played through you on that day and going forward.
I think when you have survived something like that, you feel that there's a sense of purpose, that you have a reason to be here, that you can't explain why you're there. You're very happy to be alive, but that you have to move on and say, how can I make a difference and how can I help other people? And I think that really is what kept so many of our fire personnel and our other first responders really moving forward. The idea that how can we make a difference? And certainly the rescue and recovery efforts that occurred at that site lasted for months. And that was really the intention of that workforce, to make that difference and help the families who had lost people find some part of who they were missing and give them some sense of closure. That drove people. It really did.
I have heard from firefighters and therapists who did counseling work at that time that such work was not necessarily an easy fit within the culture of the FDNY, and yet I think the need on all sides was felt to be obvious. Severe emotional impacts on the members and their families, both through the immediate loss of 343 firefighters, hundreds of children, as many as 1,000 having lost a father. And then over time, the cumulative impact of illness and death within the first responder and the rescue and recovery community. And these are very, very close-knit communities. How did this element of mental health awareness and the acceptance of emotional counseling and other kind of psychological help, how did that develop over the course of time? And how important has it become to the department's sense of how to respond to injury or death? Has that changed?
I think there are several issues with mental health that are important to think about. One is that first responders don't always take care of their own emotional needs. They tend to think of how they can help someone else. Time and time again, people would say, "Doc, I'm worried about this guy. I'm worried about that person," without acknowledging that they themselves might have a problem. I think also there is a time or moment in where people can accept that they need help. And our role many times is to help them see that need. That day that we lost so many people, 75 firehouses lost at least one member, and many lost more than one member. We had a pre-existing counseling service unit, which was there on the ground ready to go, but a small unit of approximately 11 people, led by Malika Corrigan, who's one of our most seasoned professionals. If you remember, the fire department loses people in line of duty deaths every year. We had just had a major event on Father's Day where we lost several members and had many people who were injured. So we were still recovering from that. That loss was terrible, but we, at the end of the day, had the person. So we could have a burial, we could have a ceremony. There was, for the family, a support. In this event, we had people missing, we had people's status unclear. We went from rescuing and to recovery, all of which were a difficult transition. And many members and families were never found. So what we're doing is trying to set up programs quickly to take care of people. We were helped at that time by the IAFF and the National Fallen Firefighters Foundation, who brought toward us resources to help us. They brought peer counselors so that our peer counselors could be trained, so that our own firefighters, active and retired, could move forward with training and therefore reach out to our members. We were able to embed psychologists in some of the firehouses that had been the most hard hit, just to sit in the kitchen, talk to people, and perhaps draw people out. We were able to set up, again through Malika Corrigan, multiple satellites so that people could be seen in the communities where they lived. So we set up a satellite on Staten Island, up in Orange County, out in Long Island, out in Queens, as well as our original location in Manhattan. By having those areas, you were going to reduce the barriers for help. We used alternative care, again, through Project Liberty funding that we had, so that in some of the sites we had acupuncture. Now, no one would tell you that acupuncture is going to fix mental health. But so many members have said to me, by going to acupuncture, they were able to sit with other people and talk, and that shared experience, that sharing of their thoughts really helped them in the long run, so that people heal in different ways. We had programs set up for groups for the spouses who had lost people, We had parents groups so that those groups met with other parents who had lost their children. We've had groups for called Brothers to Brothers, because so many brothers have lost their own relative that day. And we had programs that tried to set up the different groups that we had in our workforce. And again, some of those programs have existed to this day. The Staten Island group that meets has been meeting every Thursday since that day. The only thing that has shut it down is COVID, because other than that, they've continued to see each other. The group comes and goes and different people are there, but it's also a program that brings together so many people. We had a lot of retirees or retirements right after 9/11, particularly after the closure of the site. And we had a lot of retirees who came forward to help. So that having a program to keep that group of people involved was important. The Stay Connected program was important in that regard because it brought together the retirees who might have sort of fallen off that had not happened. We started a tobacco cessation program because tobacco cessation was a program to say, we can't change what you had experienced that day. We can't change the exposures and the problems, but we know if you've had an asbestos exposure and you stop smoking, you improve your chances of not having a problem. That program was highly successful. And it also was an acknowledgement to people that our health services cared about people and that we were there to help them during a difficult time. Again, I think that's an important message to a workforce to know that their health is valued.
Let me ask, you have been an author or co-author on many scientific papers that report on the impacts of the effects on the health of first responders. Obviously that gets technical, but I wonder if you could just summarize the principal findings of this research. What were the main impacts? And I want to tie this to a question that came in from Joseph McCauley, asking how many people in the department have developed sarcoidosis, and is that a stable number or is that an increasing number?
Okay, so the summary of some of the work is that, as I mentioned, different exposures will change your likelihood or could change the rate of illness. So that immediately after 9/11, within the year after, there was a significant drop across the board in pulmonary function tests. Again, we had a good comparison of pre and post 9/11. The year or two after that, there was gradual improvement in almost all people, but not all. And for the people who were continuing to have marked changes in their breathing tests, there usually was an underlying medical condition that was found relating to their lungs. When we look at exposures, again, it was based on how early you were there at the site as well as how much time you spent there. Those became the two factors that determined some of your likelihood of developing a medical condition. And many of our members had more than one medical condition. Some had as many as three. And you also had a big interaction between physical health problems and mental health problems. Because if you don't feel the way you did before, and you have gone from being what appears to be a healthy, well person who's used to physical work, and now you don't feel the same, that has an effect on your mental health. So that those problems often interacted, and taking care of both sides of that became important. From a viewpoint of what kinds of problems, we had a lot of upper respiratory sinus problems, chronic rhinitis, tracheitis, which is inflammation in the throat, as well as pulmonary problems such as reactive airway disease, asthma, as well as some small numbers of people with interstitial lung disease, as well as sarcoid. Interestingly, because you bring up sarcoid, pre-9/11, firefighters have always had an increased rate of sarcoid. So that Dr. Brezan's studies had shown that sarcoidosis was an issue pre-9/11 in many of our firefighters. The difference was that not only did we have more people with sarcoid after 9/11, but we had more significant cases of sarcoid. In the past, we had people who we were able to treat, and for the most part, they could go back to work. After 9/11, people had much more significant symptoms and more manifestations of the illness, so that in many cases it became career ending. So our numbers are still up there for sarcoid, but we are continuing to monitor people and see what's going on.
Let me ask, I got a question here from Diane Cruz, who worked at 1 Chase Manhattan Plaza, was in the dust cloud on 9/11. She went back to work as downtown reopened. She says she was sitting near air purifiers in her office, and she felt a burning in her nose and throat, and she lost her sense of smell. She wants to know if that is a common symptom or a reaction to the kinds of conditions that people were in down there.
It could be. It definitely could be, because when you're having sinus and chronic rhinitis, you often will have a loss of the sense of smell. That's something that an ear, nose, and throat doctor should be looking at to see what's going on. Certainly, there's been an uptick in thyroid cancer in many of the people who are at the site, not only in our members, but in people in that community.
When we spoke before this program, you spoke of 2 waves of first responder rescue recovery worker deaths. The first wave, particularly in regards to the first responders, the FDNY, is a fixed number that is actually inscribed on the 9/11 memorial. The second wave is a number that extends over 19 years since 9/11, 18 years since the end of the cleanup, and that is not a fixed number. That is a number that increases. Last year, of course, we dedicated at the Memorial Glade on the Memorial Complex, we dedicated this glade as a gesture to this second wave of illness and death from the effects of having come to the site to help. I know this had a big impact on you and on the community, and I wonder if you could talk about, what that impact is and what it means.
That the glade is so important. The glade is really an acknowledgement of the long-term consequences of that day and the effect that it had on our first responders and those who were down there. Because it shows that over time, the losses that we suffered, which was substantial that day, almost 3,000 victims of 343 fire, as well as PD and other first responders. That number keeps growing, so that it's not a fixed number, because each year we continue to lose more people. And the glade is an acknowledgement of that the people who put their lives on the line that day are still having losses. The fire department has a wall for the line of duty deaths. And each year, unfortunately, we add another person, much as we try not to. On the other side is the wall that has a document showing the increased number each year of people that we're losing through 9/11 deaths. And that wall is over 200 at this time, with another 20 plus to be added this year. And those are individuals who were active, part of the 9/11 response, and died of a documented World Trade Center illness. And unfortunately, that wall has had to increase because each year we see more people. That does not even account for the people who were retired and came forward at that time and again put their time in as retirees and have subsequently had medical issues. We have a very robust cancer care program, and that is good and bad news. We're there to help people, but of course the bad news is each week, each year, we keep getting more people in the program. And of course our goal, again, gets back to early detection, prevention, and making sure that people get good care. So we're very thankful that at the moment there is adequate medical attention and care for these individuals. In the metropolitan area, we have been able to partner with some excellent institutions who work with us, accept the World Trade Center health insurance, and they take excellent care of our members. Sloan Memorial Kettering, NYU, Mount Sinai, Northwell, all these programs have been a godsend to us because they are helping us take care of people who need help. And our role is to help people move through that system and get the care that they deserve. So many firefighters, fire officers, when they find out they have a serious cancer or even facing their mortality, they will say, I don't regret being down there, that I have had 10 more years or 12 more years or 18 more years than the people I worked with. And I'm grateful for all those years that I have. And it's not just one person who says that, it's so many of them, that they acknowledge that they had a gift of life and that they feel that they did what they could. They're proud of the work that they did and that they would like to still stay, but they realize that some of these illnesses clearly relate to their exposures at that site. They're an amazing group of people.
Tell me about them a little bit. You know, you're the daughter or granddaughter of firefighters. You spent much of your career in close proximity to firefighters of every rank and every specialty. You have seen the impact within the department and upon individuals and their families of losses within the department and the impact of this kind of service. Yet we have many cases of children of firefighters who were killed on 9/11 or first responders stepping forward into the same service that took their fathers away from them. What drives people to do this? How can you help us understand what it is that brings people to step forward under these circumstances?
You know, even after 9/11, the need to hire new people was clearly there. And people who came forward were often the children of members who had died. So there really is an ongoing continuity of members who have these connections with others. I think first responders have a calling, and I think particularly whether it's in fire or PD or the military, as well as in the healthcare profession, that people feel a calling. They feel that they believe that being part of that organization has great meaning to them, that they can make a difference in other people's lives, that they have a skill set or will develop a skill set that will make a difference for other people, and they believe in the greater good. I think they're ultimately optimistic because they feel that they can make that difference and that the work they do will be important not only to their own family, but to the other people in the community. They're really exceptional people.
Indeed. Allison asks, what can people do to help first responders today? And we know, and I'll come to it out of your answer to this question, we know that first responders are stepping forward in relation to the COVID crisis. So what advice would you give if someone wants to help first responders, offer help to them in some way today?
What I'm going to say may sound repetitive, but when you think of the first responders right now, we're thinking of the people who are manning our ambulances, who are manning our emergency rooms, who are taking care of our sick ones, our family members in the hospital. And the wave of illness that really took over our medical community was very hard for people to manage. And the only way to reduce that wave is to utilize what we have in place. Currently, we have no really well-established treatment. We have no vaccines. We have only prevention and trying to prevent the next wave. So when you get tired of hearing people say, wear a mask, wearing a mask is your way to protect other people. When you do not wear a mask, you're saying, I really don't care about other people. When you wear your mask, you're reinforcing that you care about your community, that your family, and the people in the world you exist in. When you keep your distance, when you use proper hand washing, you're caring about the people around you, and you're reducing the likelihood of that next wave. We are all hoping the medical community can find scientifically ways to treat this, ways to prevent it, ways to take care of those who are ill. Work is going on constantly in all of the institutions to come up with answers. But for now, we have a limited way to protect people. And when you do the right thing, you're helping your first responders.
Amen. I did want to bring you a question from Christopher, who asks if you think the tragedy of 9/11 prepared us in some way for the current COVID tragedy and the burdens that we faced as a society and as a medical system then. And are they in some ways feeding into the responses that we see today? Are they similar? Or are they different?
I guess a little bit the same and a little different. I mean, I think 9/11 was an instantaneous attack with long-term consequences because we have seen those consequences play out. I think initially New York was seen in a very positive way. People saw us as being affected, and there was a lot of empathy and care. Several years down the line, when we were looking for support for financial support to take care of the ongoing medical needs, many times around the country, there was a feeling that this was a New York problem. And it really took someone like John Stewart, Ray Pfeiffer, and the other firefighters to show that this problem is a worldwide problem. And again, now we're in another war against a virus, which has sort of slowly crept into our country, that clearly is a worldwide problem. And yet New York, again, is in the epicenter, partially because we are a dense city. Many people come and go in our city. We are a tourist attraction, a business and cultural center. And as a result, New York is the epicenter of this illness. So when you hear people say, we don't want New Yorkers to come visit our state, there's a negativity attached to that obviously bothers me as a New Yorker, but also is not recognizing that we are in the epicenter for a reason, and we're here to take care of people. I think this COVID crisis has brought people together in a good way. People have an acknowledgement of the value of our first responders, of the EMTs and the people who are bringing people to the hospital. We have a better acknowledgement of the grocery store personnel, the people who man the stores that help us out. And we realize how fragile our food chain is, and that each person plays a role in taking care of other people. That we're not the sort of islands, that we need to be with other people, even as we're separate. So those are some of the differences.
I wanted to ask, it does seem from what you're describing that the first responders, the rescue recovery workers who have these health effects from 9/11 are, it would appear, more vulnerable to the impact of COVID and perhaps more severity if they get it. Is that the case? What are you seeing in terms of your patients dealing with COVID?
It's clearly a concern because many of the medical problems people have because of their 9/11 illness may increase their risk of having COVID or more serious versions of COVID. anyone with respiratory problems, anyone who has these chronic either autoimmune problems or certainly cancer are at increased risk for COVID, and that remains a concern. Our programs, from a monitoring viewpoint, have essentially shut down except for telehealth medicine. And we want to be sure that people are continuing to get the medications and the other care that they need, and that's ongoing. We're currently surveying our population to see what's going on with COVID. And those numbers will change too, because someone might have COVID in March and not have something in August. So we're going to be continuing to monitor that. And when we get up and running again, we'll be checking antibody levels to see what's going on. Because we do know there are people who have had this illness and yet have no signs of the illness. So the antibody studies will be helpful to give us an idea of how our population is doing.
You said before, when you were talking about your 9/11 experience, that you recognized in that moment that the world had changed and that for your children, things were going to be different. And I wonder if you have a similar feeling in relation to COVID. I mean, it's coming one thing after another, it seems, these huge impacts. But does that feeling correspond as well to the moment we are in now, do you think?
Very much so. I think all of us are feeling that change. I think I've always talked about what would happen if something came or if we had a virus or something that might occur. But when you see it up front and you see the impact on an entire population, it's just incredible. And I think we tend to think that this is an illness that will primarily affect older people. And yet we're seeing many younger people having very significant illness. And now we're seeing a group of children having very significant illness. So all of these new developments help us see how we're all vulnerable and we all can be at risk for this illness. I think we're leading or heading down a path that we really don't know the answer to. And that's always a little disconcerting when we don't have a sense of how will we control this? How will we take care of this? We're very good at planning and making decisions about what we have in stock to help ourselves. But when you have so many unknowns and there's so much about this illness that we don't know, that makes it a little bit more difficult. And that's why I think we have to say, where can we be to take care of ourselves in the best possible way? And I think making sure that our first responders have adequate PPE and not overwhelming our health system by so many cases coming in, and using really common sense in terms of dealing with protecting yourself and protecting others. Because that's at the moment all we have to offer people. And I think those changes or those rules have really kept us doing better.
Mm-hmm. That's good.
Hmm.
I think I lost him. Just hang in there.
I can hear you. I can hear you. Okay.
Oh,
So we may be having some technical difficulties, so that's the reason the program is currently on hiatus just for a few moments while those problems are taken care of.
Okay, I can't get
But we
him.
thank
Jess,
you
I'm
all
gonna
for
bring you
coming
live.
and seeing the program today, because the museum, the 9/11 Museum, does an important job of reminding people of that day and the events that occurred. Many people are now arriving in this world who have no personal experience of 9/11, and it's nice to know that this museum reminds people of what happened on that day and the consequences that have continued.
Is my timing perfect in coming back at the end of your answer? I apologize. I have no idea what happened, except thank you for carrying on without me. This is the joy of these unexpected moments. And it doesn't leave me with a great summation of where we are at this point, because I wanted to respond to the comments you just made, but I was off in the ether lost. So I apologize for that. But we are coming to the end of our time. I want to thank Dr. Kelly. I will come back to you in a moment. I've managed to come back in time to remind our audience that tomorrow, May 30th at 11 a.m., clicking this same link will bring you to our rest and recovery commemoration ceremony, May 30th, 11 a.m. It will include remarks by our President and CEO, Alice Greenwald, our board chair, Mayor Mike Bloomberg, and John Stewart, who Dr. Kelly, you mentioned earlier. I also want to ask our audience to keep in mind, in the midst of great need everywhere, that the museum is closed. We do not have visitors, and yet the costs of operating the memorial, the Glade, the museum continue in this crisis. And if you would consider a donation, you can click at a link below. You might also consider becoming a member of the museum. That's a great way to support us. In thinking about asking you to become members, I was scratching my head and thinking, well, many people are not local, so why would they become members? And then I learned, to my happy surprise, that 2/3 of our members are not from the tri-state area. And they join as museum members to support us and to come visit. And you will be very welcome as members or otherwise to come back when the museum is open. But if you would consider, amidst all the other needs and entreaties that you are considering, supporting the museum, making a donation to us, that would be greatly appreciated. Dr. Kelly, I want to thank you again. This was really remarkable. I apologize for dropping out on you there. I'm glad to be back with 2 minutes to spare. But your service to the city has just been extraordinary over these years. Your support for the memorial and museum is something we do not take for granted, and we note. And thank you again. And the opportunity to speak to you again is something I will look forward to.
Thank you.
Good night, everybody. Clifford Shannon for the 9/11 Museum.